Hello and welcome to Pregnancy Info. Today we will discuss about HPV vaccine myths, pros, cons, dosage and full guide. Many people are scared of the HPV vaccine. Some even believe it can cause infertility in women. But is there any truth in this? In today's video, we're going to clear up the myths, explain what the HPV vaccine really does, its pros and cons, who should take it, the correct dosage schedule, and why it's one of the safest ways to prevent certain types of cancers. So stay tuned because this is information that can save lives. What is the HPV vaccine? The HPV vaccine protects against the human papillomavirus, one of the most common infections worldwide. Certain strains of HPV are responsible for serious diseases like cervical cancer and cancer, throat cancer and genital wart. The vaccine is made using virus-like particles. These look like the virus but don't contain any live virus, so they cannot cause infection. Instead, they train your immune system to recognize HPV and fight it before it can cause harm. The most widely used vaccine today is Gardasil 9, which protects against 9 dangerous HPV strains, including the ones linked to cancer and genital wart. The fertility myth. Can HPV vaccine affect women's fertility? One of the biggest reasons people avoid this vaccine is the misconception that it can cause infertility in women. Let's set the record straight. Scientific studies worldwide have no evidence that the HPV vaccine causes infertility. In fact, it is the opposite. By preventing cervical cancer and other complications caused by HPV, the vaccine actually helps protect fertility. What can affect fertility is untreated HPV infection, which may lead to cancers or surgeries and damage reproductive organs. So instead of harming fertility, the vaccine plays a role in preserving it. Pros of the HPV vaccine. First of all, we will discuss the pros or benefits of HPV vaccine. Number 1. Prevent cervical cancer. Blocks HPV types 16 and 18, which cause nearly 70% of cervical cancers. Number 2. Protect against multiple cancers, including anal, vaginal, vulvar, penile, and throat cancers. Prevent genital warts. Covers HPV type 6 and 11, responsible for about 90% of genital warts. Long-lasting immunity. Protection has been proven for over 10 to 12 years, with ongoing research showing even longer duration. Safe and trusted worldwide. Millions of doses given with excellent safety record. Community protection. The more people vaccinated, the less HPV spreads in society. Cons and limitations of HPV vaccine. Now we will discuss the cons and limitations of this vaccination. Number 1. Does not treat existing HPV. If someone already has HPV, the vaccine won't cure it. Number 2. Doesn't cover every strain. That's why cervical screening like pap smear is still important. Number 3. Mild side effects. Pain, swelling, fever, or tiredness may occur, but they pass quickly. Number 4. Cost. In certain countries where it is not part of government programs, the vaccine may be very expensive. Number 5. Multiple doses required. Full protection comes only after completing the series. Dosage and schedule. The vaccine works best before exposure to the virus, ideally before sexually activity begins. Age 9 to 14 years, only 2 doses are needed, given 6 to 12 months apart. Age 15 to 26 years, 3 doses are needed at 0, 1 to 2 months and 6 months. People with weakened immune system should follow the 3-dose schedule regardless of age. The vaccine is given as muscle injection in the upper arm. Who should get it? Girls and women, for protecting against cervical cancer and other HPV-related diseases. Boys and men, to prevent warts, penile cancer, and to reduce spread of the virus. Immunocompromised people, including those with HIV. Who should avoid it? People with a severe allergy to vaccine ingredients. Pregnant women, vaccination is usually postponed until after delivery. People who are seriously ill at the time of vaccination should wait until recovery. Conclusion: the HPV vaccine is one of the safest and most effective ways to prevent several types of cancer. The fear that it can harm fertility is a myth, not supported by any scientific evidence. In reality, it protects fertility by preventing cancers and surgeries that damage reproductive organs. Yes, it requires multiple doses and doesn't cure existing infections, but its benefits are far greater than its drawbacks. If your children are in a recommended age group, this vaccination can be a gift for health and protection for the future. Share this information with other females who are eager to know about this vaccine and may be afraid of this vaccination. Take care. Bye-bye.